Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
All about pregnancy test. Let's learn about how and when to take pregnancy tests at home and when to visit the doctor to get a confirmation about the baby's arrival. What is a pregnancy test? A pregnancy test is designed to check the level of human chorionic gonadotropin in the blood. How do pregnancy tests work? You can take the test at home with the help of a pregnancy kit or visit an obstetrician or gynecologist for the same. The body produces HCG, which doubles every 36 to 48 hours as pregnancy progresses. These hormones can be detected in blood as well as urine. How accurate are pregnancy tests? The result is 99% accurate and depends upon following the directions mentioned in the test kit and testing on the right day and the right time. When is the right time to take a pregnancy test? The best time of the day to take a pregnancy sample is the first urine in the morning. It is advisable to wait for a week before using your kit after a missed period. Early signs of taking the test include spotting or light bleeding, stomach cramps, tender breast, fatigue, constipation, excess vaginal discharge, and soreness. What are the different pregnancy tests available? Blood test to confirm pregnancy. Qualitative HCG test. It is done at the medical center and recommended 10 days after you miss your period. Quantitative HCG test. It traces the exact amount of HCG in your blood and can detect even the lowest HCG level during the very early stage of pregnancy. Urine test to confirm pregnancy. A urine test can be done at home with a pregnancy test kit. You need to follow the instructions, and you will most likely get an accurate result. Pros and cons of taking a test to confirm pregnancy. Pros. Number 1. It is the fastest way to confirm if you are pregnant or not. Number 2. You can use the test in scenarios where you were not ready to conceive but had a birth control failure. Number 3. In case of early pregnancy symptoms, you may get close to accurate results 4 to 5 days before missing your cycle. Cons. Number 1. Sometimes, the pregnancy test result using a kit can be misleading. Number 2. Chemical pregnancies appear positive on the kit but later lead to a miscarriage. Number 3. The results appearing as negative in the pregnancy kit can turn out to be positive later. All pregnancies are different, and so are the circumstances. We hope this will help you determine the status and circumstance of your pregnancy.